Righto, thanks Gerhard for the invitation, and thank you to our distinguished guests for making the trouble to come so far for the conference. Thank you to the Kaumata and Professor Reid for your rousing welcome. I'll indulge you with a little of my story of getting into sugar and reflect on where we've been so that we can look with greater clarity to the future. In my medical training, which funnily enough a lot of it happened in this very lecture theatre, I confess that I learned almost nothing about sugar. On my elective in my final year, I had the pleasure of working in a remote hospital in Cameroon, situated just below the Sahara Desert. I couldn't understand the reason the medical school gave me such freedom. I was just looking forward to travelling outside cosy New Zealand for the first time and taking my high school French for a spin. Again, I didn't learn a thing about sugar other than I drank plenty of it in the form of fizzy drinks, as clean water was hard to come by. One thing I did learn that 6 years of medical training couldn't teach me was that the hospital was picking up the pieces of larger structural issues that were happening outside its gates. Working inside the hospital, we were powerless to stem the tide of suffering that was coming our way. Malnutrition, malaria, gastroenteritis, HIV and tuberculosis were diseases that we in the hospital could only apply a band-aid to. We were picking up the pieces. The causes such as overcrowding, poverty, lack of sanitation, poor food hygiene were simply too hard. All the hospital staff, including myself, desperately wanted to address these problems, but it was messy and complicated, involving tribal politics, resources, meeting with interest groups. It was much safer to focus on treating the sick within the hospital compound. The trip galvanised my interest in the mysterious but elusive world of public health. But back in New Zealand, public health seemed even more complicated, so I went back to the safe and familiar world of medicine. It didn't take too long to realise that throwing drugs at conditions that were caused by what patients were eating, drinking and smoking was deeply unsatisfying. What was important was the way society was structured and how these problems began. Failing a medical Part 1 exam cemented the case that public health and epidemiology were going to be a more fruitful career for me, and the lessons from the trip to Cameroon were ringing loudly. Fast forward to the beginnings of my public health career, and I started to get disillusioned once again about how I could make a positive difference. Out of the blue, a certain remote figure, a Professor Richard J. Johnson from the University of Colorado, had written a tentatively titled paper, Hypothesis: Could excessive fructose intake and uric acid cause type 2 diabetes? This paper drew together different threads of evidence which linked sugar intake with our modern epidemics of metabolic disease, obesity and diabetes. From this, I began to see the fingerprints of sugar everywhere. It was like the scene in The Matrix, where Neo is offered the red pill and sees how far down the rabbit hole goes. Sugar was in cigarettes and supposedly healthy breakfast cereal, my healthy organic orange juice, sauces, soups, some peanut butters, as well as the obvious sources, soft drinks, cordials, biscuits, cakes, lollies and ice cream. The list goes on. The epidemiological evidence of harm was also astonishing. Sugar intake was linked with diabetes, gout, cardiovascular disease, rotten teeth, high blood pressure, raised triglycerides, fatty liver. Again, the list goes on. Many health professions owe their existence almost solely to cleaning up after the consequences of our love affair with sugar. About this time, in 2010, I put together a paper about what I saw as the New Zealand fructose fountain, and was surprised that I had a vociferous rebuttal from academics associated with Chelsea's Sugar Research Advisory Service. The rabbit hole was getting deeper. Enter Gerhard and the first FIZZ conference. Rick and Robert Lustig presented, along with the Living Closer Foundation, and the science about sugar and its effects were hotly debated. But a small social movement grew. Rob Beaglehole, a public health dentist, fomented Sweet Revolution in Nelson, spreading around the country, raising awkward questions to health, civic and education leaders about why they continued to profit from sugary drink sales. Gerhard, Rob and I presented a sugary drinks policy brief that was enthusiastically received by representatives from the Māori Party, Labour and the Greens. Gerhard took this sugar-free message to Kelston Boys schools and other schools in Kelston. Kelston Boys is, by the way, my old stomping ground. And Marcelin College in Mount Roskill. Since then, sugary drinks have come out of our hospitals. Schools are beginning to address the issue of sugar, following on from the inspiring example of Yendara Primary. As I found out on the weekend, the Ministry of Health is monitoring sugary drink policy in schools. That sugar form built the message to a wider audience. Public health organisations like Toi Tangata and Hapai Te Hora led calls for sugary drink-free festivals. Nikki Bezant is leading a campaign to petition for a sugary drinks tax. Louise Signal, here in the audience, is exploring the extent of the influence of marketing of sugary drinks in children's lives. You'll hear more from her later. Tony Blakely and Cleona Nimerhu are modelling the effects of a sugary drinks tax. Auckland dentists are adopting schools to address their sugar intake. Gerhard, along with other upstarts, have questioned why we are feeding our infants sugary baby food. We are all starting to ask awkward questions like, why are we as a country spending $20 million a year yanking out rotten teeth from anaesthetised kids? Overseas, we've seen other countries governments take action. The United Kingdom, Mexico and regions of the United States have either committed to or implemented sugary drinks taxes to discourage intake. The early evidence of their effects is promising. Through these initiatives, the question has been raised, should we, here in New Zealand, tax sugar? The evidence and public support for the tax are growing. So here we are today to hear from esteemed academics, children, researchers, politicians and even the beverage industry about how we can make positive change to reduce the harm from sugar and stop the sugary tide of ill health from coming through our hospital gates. Thank you for taking the time to attend. Sit back, engage and enjoy.